this episode of Horse Shelter Heroes.
There's not supposed to be any laxity. Like, this isn't supposed to happen.
We had to dorm him. He was acting a little bit of a fool, just dancing around, and I couldn't get anything done.
This is Sapphire. She came to us through our buyout program. She was on a slaughter truck.
Today we are expecting 15 to 20 German Shepherds. What we know about them is that they're show dogs.
This is very exciting, / we need power tools to open this box.
Joy has found her forever home.
You don't want to miss a single second of Horse Shelter Heroes.
So this is Xander. He came to us from Colorado. He's in today to have his teeth checked and his back checked and his heart. On Thursday last week, he was in the round pen getting worked with Haley, and they noticed that he had some foul odor to his breath, and he had some pain on palpation over his back, and he also had an extra heart sound. So we're in today to look at him and make sure that everything looks good or find what we find.
He's got a little bit of arthritis, but nothing earth-shattering.
So we are done taking radiographs of Xander. We found that he is missing a tooth, and the tooth that's next to the missing tooth is also questionable, so we really need to get the speculum on, and Dr. Lydia is gonna take a look, and if his teeth need to be done, then she's gonna float them. We took radiographs of his back, and there's pretty mild changes there, so most of the pain is probably soft tissue, but it could be still from his hind legs with his hock arthritis or from his teeth. So hopefully we can rule out the teeth with this exam.
Okay, now it is. I told my husband this weekend, I was like, I gotta find this one part. I think we're gonna have to take the speculum off of him because taking this apart, there's not supposed to be any laxity. Like, this isn't supposed to happen.
We just got done looking at Xander. Unfortunately, our power float is not wanting to work very well today, so we're gonna have to reorder some parts for it and fix it up. But Dr. Lydia was able to get a good look at his mouth with the speculum on, and he is missing a tooth on this side, and he also has some pretty severe hook and wave mouth on both sides. So we're gonna have to take a more closer look at that at a later date and do his teeth and see how he does if he'll put weight back on and see if that helps relieve some of the pain that he's feeling in his face and his back, and then also do some hock injections for his back, but not all is lost.
This is, I believe, Baby. She came in from one of our Colorado transfers. So today she's just getting her feet worked on so we can put her up and make sure she's ready for adoption.
Not great, but not terrible. It's definitely due for a trim. Her frogs are a bit weak, but they're also super trappy, so they'll do better once they get trimmed up.
So out here we have Rowdy. He's one of our newer babies we brought down from quarantine. So he's being a little unsteady, but he's just a baby, so we're working with him.
Just got done with Cherokee over here. He did real good, didn't give us any trouble. His feet are looking pretty solid, just needs some routine tune-up stuff. So, yeah.
This is Torito. So he's one of our Mustangs we have here. So he's going a little bit blind, so everything has to be kind of calm and quiet, so he just doesn't really get too jumpy.
Just got done with Torito over there. We had to dorm him. He was acting a little bit of a fool, just dancing around, not being aggressive, just dancing around, and I couldn't get anything done. So we stuck him, and he behaved much better after that. Still a little antsy, but but all in all, very, very workable, and he's done now. Feet are looking good. All right, we're here in the vet barn right now, and we're gonna go ahead and try to trim Sapphire. She needs it really all the way around. She's got some injury to her back legs, so we're gonna have to be really gentle back there and kind of treat her tenderly and try not to hurt her too much when we do it. But she's just been sedated a little bit, so hopefully she won't give us any trouble. We just got done with Sapphire over here. Had been a while since she was trimmed and she was really needing it, but she cleaned up really well. We had her in light sedation, but she behaved super well, no issues, so looking pretty good.
So we had our farrier Elijah come out today. He worked on about 10 horses, so everyone has better feet, so hopefully we can get more adoptions worked out. We did do some of our quarantine horses that came down. They stood pretty well. We did some of our residents, but so far everyone right now has nice looking feet, and hopefully we get some more training done today.
This is Sapphire. For those of you guys that watch Horse Plus shows, Sapphire's been on a lot of things. She came to us through our buyout program. She was on a slaughter truck. She had a history of falling through a trailer floor before she got to us. She had some really, really horrific wounds in both hind legs, and we operated on her pretty much right away. And that surgery went well. She's had tons and tons of bandage changes. And unfortunately, right about the same time, the healing of her wounds on her hind legs kind of plateaued. Her systemic health took a turn for the worse. She got pretty bad bacterial pneumonia with multi-drug resistant bacterial organisms, and she was coughing pretty badly. She had to be on a bunch of more antibiotics. She lost a lot of weight. She's lost some condition because she's had to be stuck in a stall. So she had a possible seizure, just a really quick period of time where kind of her whole body went rigid and she lost control, and then she caught herself right away. She didn't fall or anything. We are not sure why she did that, and these cases are always really hard. You know, it's never quite as straightforward as like, oh, we can fix this wound. She does need to have more debridement done, mostly on this right hind leg, and we had a guy named Rick who was amazing and gifted us an electric cautery unit, which Dr. Gina and I need to learn how to use, but we're hoping we can use electric cautery and do follow-up surgery standing, but we gotta make sure that Sapphire is doing well and is a good candidate for that before we do anything. So that's where we are today, taking it a day at a time. She was sedated just a little bit today. She got her feet done by the farrier. She was very good for that. And then I used just some basic shampoo to clean her hind legs off, and then put some topical treatments on those legs, and I'm gonna turn her out in a small paddock so she can have some sunshine time today.
Today we are expecting 15 to 20 German Shepherds. What we know about them is that they're show dogs, and we actually already have some rescues lined up to possibly rehome them, but we will keep you posted if there are more dogs that need homes.
All right, we got all the dogs out of the trailers. They're all sitting in the hauler right now, still in their crates. We're going through them one by one, double checking microchip numbers, making sure they all match their paperwork. And we're also heartworm testing them, giving them dewormer and vaccines. And if they need microchips, then we'll microchip them as well. All right, we got all the dogs intook, got them all checked their microchips, and got them all vaccinated, heartworm tested, all that good stuff. So we're gonna let them hopefully decompress for the night. Got them food and water and some bedding, and hopefully in the next few days we'll be able to transfer them all out to different organizations and get them into good homes.
If you enjoy watching veterinary medical and surgical procedures, such as castrations, eye enucleations, and abscess lancing, go to our YouTube channel, Horse Plus Vets. We have no censorship on that channel, so if you want to see all the details of us providing medical care to shelter animals, just go to YouTube and search Horse Plus Vets. This big sweet lady behind me is Faith. She came in through our buyout program out of the slaughter pipeline this past month, and she is completely blind in both eyes. She can't see at all. She's about 20 years old, and she's not missing her teeth, but on one side of her face, her teeth are worn down past the level of the gum. So she still has a functional occlusal surface, but only on half of her mouth. And she's in a category where I am recommending that we remove both of those eyes because long-term they're prone to irritation. She has kind of chronic tearing, but she's not in the category like Jay or Endeavor or some of those other horses that we have that come through that are like, this eye pain is so off the charts, we have to do this surgery right now. So we brought her down to our veterinary hospital day before yesterday to make sure she was really well hydrated. And we were gonna do her surgery this morning, and Dr. Gina and I had a really good talk. And it's a big surgery. Removing eyes, it's one that we do a lot, but the optic nerve runs right to the brain. It's inevitably, it's a big procedure. They have a lot of post-op pain. And we just wanna make sure that if we're considering her to be kind of in a hospice situation because she doesn't have a lot of time left with her teeth, that it's fair to her that we're putting her through this really big procedure. So anytime we're not really 100% sure that what we're doing is in the best interest of our patients, we pump the brakes a little bit. So Faith is gonna go back out into our quarantine pastures. We're gonna make sure that we're really closely monitoring her weight and body condition score and her intake. She's eating and drinking really well. She seems to be very stable, and she seems to be a well-adjusted blind horse. So I'm about to turn her back out into a pasture, and we're gonna let her finish out that 30-day quarantine period, and then we'll reevaluate. Thankfully, her blood work showed that she systemically is in good shape. She doesn't have indications of any other major systemic issues. And she's a really good girl. She's a little jumpy, but I cleaned her stall yesterday and I started humming, and as soon as she could hear consistently where I was, she calmed right down. She's a very good girl. I just turned Faith out into one of our quarantine pastures. We've got her in a fly mask to make sure she doesn't have more irritation from UV or flies with those eyes. And we're gonna let her finish out her quarantine period, and we'll keep a really close eye on her and keep monitoring her. But for now, she has a little bit more time before we're gonna reconsider that surgery.
We are here this morning with Miss Honey. We're gonna clean out her ear and re-topically apply this wound ointment to her ear and other wounds. She is doing a lot better. She's getting really feisty and does not really want us to mess with her too much except for food. But we're about to go in and address her wounds.
It's almost like Dr. Gina just cleaned and medicated Honey's wounds. I am so happy with the progress that she's made. She is healing well. This was her worst wound when she came in. This whole leg was swollen, and it's doing better. Her systemic health is doing better. She still has a lot of irritation in this right ear, but when I first saw it, I thought for sure, you done? I thought for sure we would have to amputate the whole ear, and I don't think we're going to. She's just gonna have this cute little nub of an ear. I've been spending a lot of time with her on my lunch break, hanging out, and she's really warming up to humans a lot. I think she knows that we're trying to help her. So I'm really hopeful that we'll get her to a point where she will be adoptable very soon. She's so young, she's only 1.5. When she came in, she looked like an ancient thing that had been through a lot of hard stuff, but she's very sweet. You're a good girl.
So we currently have some different organizations and people here looking at these German Shepherds. Just going through and we're doing a little more testing with them, figure out their temperament. And these people are just doing an initial walkthrough to see if there's anyone that they're interested in.
Hi guys, my name is Courtney Robbins with Global Canine Protection Services. We're here at Horse Plus after they received 20 German Shepherds, and we came to check them out to see if we can help them out. Luckily enough, we are taking one male German Shepherd with us named Dakota. We hope we can socialize him, give him a nice good cleanup, and hopefully find a forever home soon.
So right now I am currently getting ready to head to the airport. So I will be gone for about a week. So I will be headed back to Arizona to do some more work with the Navajo Nation and help out as a Horse Plus member out there, and just hopefully everything goes well and smoothly and we get a lot of work done, and I will be back on Monday.
So right now, Cayenne is getting adopted. We have to do 2 more of her shots since they came about 2 days ago. We haven't really gotten to all of them yet, but we are getting her shots and they're doing the paperwork and she will be good to go.
Cayenne just left with her adopter. We've been working on getting her adopted this afternoon. We're just excited that she's finally found her forever home. So it looks like we have a big shipment, and it's very exciting because we think it's a surgery table. This guy's actually a good driver, because see the way he backed into the bay? That's awesome.
This is very exciting. / we need power tools to open this box.
We could,
somebody go get Dr. Gina.
you can fit a lot of things in this
We gotta
box.
get Dr. Gina. It's a really rainy, dreary day at Horse Plus, and it's a Thursday. We didn't have any surgery scheduled this afternoon, and we've just been doing paperwork, busy work, and we had this huge truck pull up, and we didn't even know that our surgery table got ordered. We knew it got funded. And this is our new surgery table. Dr. Gina and I have to share heights. Not the plywood, it's in there. We're not authorized to use power tools, so we're gonna have to wait for Keith or Jordan to open this box. But we're really, really excited. This surgery table can change heights. So that's important, not just for the veterinarian, but also for the procedure.
Yeah.
Sometimes if you're doing a really big, cheap, deep-chested dog, you need the table a little bit lower. I've actually never worked somewhere with an adjustable height surgery table, so I'm really, really excited. The other super great thing is our lab equipment is currently all stuffed in our office because you can't have your lab in your surgery room. And so we're gonna use what we're using as our current surgery table to set up a new lab space, and it's gonna be stainless steel and a dedicated space. So it's exciting. We've been waiting to be able to do this until this came. So we're really, really grateful, and I feel horrible. I don't remember the name of the person that funded this. I know Tani knows. I don't usually interface with donors, but whoever you are, we are super thrilled. We also got 20 German Shepherds this week, and all of them need to be spayed and neutered. So we're gonna put this to good use very, very soon.
At Horse Plus Humane Society, our goal and mission is to save as many horses as possible out of the slaughter pipeline. Through our buyout program, we are intercepting horses before they even get to the auction. Our goal is to rescue as many horses as we can, bringing them to our organization and letting our expert veterinarians evaluate them to determine what each horse needs as an individual. We help as many as we can, even if they need the last act of kindness, because we believe that every horse is deserving of kindness and medical care and treatment. When horses come here to Horse Plus Humane Society, we're able to tell their stories and transform their lives. But none of it would be possible without support from people just like yourself. So please make a donation right now. The horses are counting on us, and we are counting on you.
this is one of the 20 German Shepherds that we got in the other day. And she's going to her forever home. So I was just giving her the last few little injections that she needs in order to leave here fully vetted and ready to start her new life.
Joy, joy, joy. Oh, we are so excited that Joy has found her forever home, and I think she's excited as well.
Our adopters just left, and they took one of our German Shepherds named Joy, and now she's going to her forever home.